Hi, here at Maui Derm, I was very delighted to talk about my enjoyment of caring for children who have pigmented lesions. It's a real challenge in dermatology, and we're really great at identifying problematic pigmented lesions in adults. Actually, the number that we need to biopsy to find a melanoma in children is almost 1,000. So we can do better, and my talk focused on problematic changes that would require a biopsy and our hopes to identify safe, benign pigmented lesions in children that don't need a biopsy and really spare procedures to children who don't need them. For example, Spitz nevi, halo nevi in children are benign lesions, and when they're changing in a concerning way, for example, bleeding or asymmetry, a biopsy is indicated. But for the most part, we do a lot of monitoring in pediatric dermatology. 3 areas that I focused during my talk. First, on congenital nevi. There's a great paper in the journal Pediatrics with recommendations on care for newborns with congenital nevi that I refer the audience to. Second, our evolving understanding of when patients who have congenital nevi in infancy need MRI screening in order to identify neurocutaneous melanosis. And third, I talked about ways that congenital nevi patients experience changes that do need workup, for example, concerning skin changes or new neurological changes. Thank you.